Hello everyone, myself Dr. Manoj Aroskar. I am from KES LADP HMC Vengurla Homeopathic Medical College. I am working as a professor in the department anatomy, and I will be dealing today with anthropometry under the topic 4 children and adolescent 5 to 19 years of age. Now you must till now you must have learned about what is anthropometry and what could be the introductory part of the anthropometry. Now this module we are going to cover today is divided into two sessions. The first session, which focuses on anthropometry of children and adolescents 5 to 19 years of age, which I would divide into two parts. Why nutrition matters during the childhood and adolescence, that is one thing, and second, what nutrition related conditions are identified through the anthropometry. Firstly, we will deal with why nutrition is important for childhood and adolescence. Now, as you all know, the age group we are dealing with, the children and adolescents 5 to 19 years of age, have high nutritional needs because they are growing rapidly. Now, this is the age where you require more nutrition. This is the age period, especially the age period of 10 to 19 years of age, whose growth can be as rapid as you can see right from the birth, infant age, up to the age of 6 months. As compared to that, this particular age group 10 to 19 years of age group has got rapid speed of growing, and to provide this or to maintain this rapid speed, you require to have a good nutrition. So, adolescent boys and adolescent girls in this age group have high calorie requirement, high nutrition needs than any other age group. As you all know that this is the age group where these people, that means the boys and the girls, they are in the stage of puberty and they require much calories to develop themselves. Now, coming to the point, why you require nutrition in this age group and how you can provide it. Now, as you grow, you want to make yourself healthy, you want to keep yourself healthy, you will be having different food choices, and among those food choices, how to select those food choices, what for? To promote fitness, to improve your ability of learning, to provide your body enough amount of energy which will keep you fit and keep you healthy. So, that should be the goal of everybody, that one should know that why I should take healthy food or why I should take good nutrients, just to provide yourself the three things: the fitness, ability to learn and grasp, and to keep yourself fit, to have enough body energy which will make you to learn and understand and grasp the things which you require to do in this particular age group. Now, how will you do this? We have learned why you have to do it. Now, we will see how we can do it. Now, there are certain 5 to 6 points which you will have to remember for that. The first, limit intake of food that are high in the sugar, that is very important, high in the sugar and as well as the lipids, so the fat. Now, what they will do? These foods are more likely to increase your body fat and in fact increase your body weight than as compared to your age, as compared to your height. Second thing, drink plenty of water, reduce your intake of sugar, reduce your intake of sodas and soft drinks and all, that is second thing you have to keep in mind. The third thing, learn to prepare your own snacks. This is very important, learn to prepare your own snacks. Now, how you can do it? Always keep that in mind. If you think of snacks in this particular age group, do not go to the fast food. It is very important that you see that your snacks consisting of vegetables and fruits. Second, your snacks should compile of nuts, seeds like pumpkins or sunflower seeds or whole grains, oats. All these things are they play a very important role in your life to maintain you healthy and to provide you good nutrition. Next, one more thing you can do, that read the nutrition facts which are available on network also, on in the books also, in pamphlets also. There are nutritional facts which can be read by everybody and see where you stand. That is very important, to assess yourself by yourself, that where you stand, what do you require, what do you require to keep you healthy, what do you require to keep you fit. That is very important. Eat variety of food on every day. That means you just do not have to stick to one type of food on each day. You have to eat variety of food every day. So, you can change the pattern of food every day, but even if you change the pattern of food every day, you have to keep that in mind, that you are eating healthy food, you are eating nutritious food which will not hamper your health. That is very important. One more thing, all these things you need to keep watch on your weight, very important, on your size, on your dimensions, because by eating all this food, on the other side you have to see, you should not be overweighting, or you should not be gaining more weight what you need to have at your age or for your age. That is very important fact one should keep in mind. Now, we have seen that why you require nutrition, how you can provide it, and how you can take it for keeping yourself healthy. On the other side, if you do not, that means if you do not take the nutritious food, or if you fail to take nutritious food, then what could happen? You may be seen under undernutrition group or undernutrition category. What could happen? What are the bad effects of undernutrition? One, you can have delayed sexual maturation. That means you may achieve the puberty at a delayed age. Second, you can slow your rate of growth both in weight as well as in height. Then, if you are not providing yourself good nutrition, if you are undernutrited person or you are undernutrited child, then your ability to learn, your ability to concentrate, your ability to grasp or comprehend, that will automatically get reduced, which will affect on your school performance, which will affect on your achievement of life. So, lowering of school performance and achievement. If not, if it is overlooked even after this, then there is a chance, chance that you may go under malnutrition. And if you go under malnutrition, and if you are an adolescent girl and you are you yourself is malnutrited, then there is a chance that you may, in your latter age of a group, you may produce an underweight child, and or you may deliver a low birth weight child, or you may deliver a child or a baby who is having birth problem or premature birth problem or preterm problem. So many things can be seen if you yourself have not kept yourself healthy and has not taken the nutritious food or calorie food at this age group. This is very important. So, why I am saying this? Because nutrition has got very important role to play in your life, particularly in this age group of 5 to 19. If you do not look at good nutrition, if you do not give importance to the good nutrition, or if you do not follow the criteria which you will have to follow to keep yourself healthy, then what could be the outcomes of inadequate diet? One, poor growth. Second, poor cognition. Now, see, poor growth, that means growth in both sense, in the growth in the sense of weight, in the sense of height, as well as in the sense of your mental ability, the capturing ability, the learning ability, understanding ability. All those things will have its effects if you are not having good nutrition. Secondly, you may have a poor cognition. A poor cognition, that means poor understanding, and which will affect naturally on your working ability. Then proteins. Proteins are more required, you all know, for muscle development. So, if you do not have got nutritious food in your life, if you are not taking nutritious food in your life, naturally you will have, or you will see that the muscle development is poor in your body. Once the muscle development is poor in your body, as you all know, that muscles are those things which keep you moving. So, naturally if you are not developing your muscles, or if you are not taking that nutritious food which is developing your muscles, then naturally you will develop a reduced working capacity. So, your working capacity in all will be reduced, and all those things will affect on your social life, as you will be a poor developed child, you will be a poor cognitive child, and you may find yourself under the stage of interrogative. So, you may find yourself in the stage of poor social development. Then once this happens, once you are physically not well grown, you are not physically fit, you are not physically capable enough to withstand with the atmosphere and all. So, naturally you will be a susceptible child, or you will be a susceptible adolescent who will have high rates of illnesses, and all those things which I have just introduced or just mentioned in the earlier part. It's poor growth, poor cognition, poor muscle development, reduced work capacity, poor social development, high rates of illness, all those will have effects on difficulty in school. That means, this age group is that age group where the children or adolescents, they are in the teenage group. So, they are going in a school. So, all those performances in the school, all physical as well as mental as well as academic, non-academic, all those performances in the school will be hampered, and again that will again have adverse effect on your social life. So, the summary here, or the thing here you have to keep in mind, that all those things, if you want to prevent, if you want to avoid, you have to have the good nutritious food. Now, on the contrary, now we have seen till now that what could happen if you are undernutrited, or if you are underweight, or if you are malnutrited. Now, on the contrary, other side of this coin, overweight and obesity, that can also likely to happen. If you now see, overweight and obesity at this age is likely to happen more, not just because you are taking more nutritious food, but it can happen, or can be seen just because you are not taking quality of food, or not taking what you have to take, or what is needed for your body. That can be the most important reason why you can become overweight and obese. Now, why you have to think about this overweight and obesity? You need to think about this overweight and obesity because you all know that it increases the risk of chronic disease. Increase the risk of chronic disease, maybe in short term or maybe in long term, but it can. Then obesity can cause the early effect on your puberty life. That means, if you are obese, or if you find an obese girl, you may have precocious puberty to be developed. That is in case of girls, but in case of boys, your obese boy can delay your puberty. See, obese, that what does it mean? It means that overweight and obesity will have contrary effect on girl and a boy. In a girl, it can produce, or it can initiate the puberty at an early age, that's what we call as precocious puberty. On the contrary, in a boy, the obesity may delay the puberty. One more thing one has to keep in mind, now not just thinking about boy and a girl, you just think about adolescent girl. Now, if you think about adolescent girl, you may find that if a girl in an adolescent age group is obese, then in the further life of her life, she may suffer from preeclampsia, especially if she get conception in her further life. Then she may find an obese girl who has concepted, she may find suffering from preeclampsia, or she may find herself in a gestational diabetes. So, all above mentioned complications have to be found to contribute the intergenerational cycle of malnutrition. This is very important. See, we have seen the effects of undernutrition as well as effects of overnutrition, that means overweight and obesity. If you collect all those things, you will find that all these points or all these things may travel generation to generation and may be found to contribute the intergenerational cycle of malnutrition. This one has to keep in mind. Now, we have talked about the nutrition, the importance of nutrition in this particular age group of 5 to 19 years of child and adolescence. However, it is very unfortunate. See, we have seen so many things till now, but if you go and do the survey, you will find that it is very unfortunate that addressing the needs of children and adolescents of 5 to 19 years of age group has not been the key area of focus among the nutrition community. Why that is so? Why this particular age group is not being focused for under the more for the nutrition committee is not, why nutrition committee is unable to have this particular age group under their addressing? Why? That is one reason for this. Why there is a lack of focus? You find the lack of focus on this age group is just because this age group shows very low degree of morbidity and mortality, very low degree of morbidity and mortality, and there is very less risk of associated with malnutrition compared to the earlier age group. That means, consider the children of preschool children, then you will find that these preschool children have got more risk of malnutrition, more risk of adverse effect, and more risk of having morbidity and mortality as compared to this age group of 5 to 19 years. So, naturally, the society of nutrition or nutritional community has got very less focus on this particular age group of 5 to 19 years. So, naturally, what happens because of this? Very limited sources you will find, limited anthropometric measurements you will find, which you can use and see anthropometry could prove its importance in this particular age group. So, part of all these challenges which we are coming across, that means your nutritional community is not having more focus on this particular age group, then we have got very less measurement methods or techniques for anthropometric assessment. Despite of all these challenges, even though these challenges are there, we need to increase the focus and addressing of all these nutritional needs for this age group. And how we can do that, or it is only just through the anthropometric assessment, right. So, we will carry on with the further part of this particular module, that how does anthropometry helps, how it helps, what for, to have the anthropometric measurements or to have the assessment of all these conditions coming across this particular age group. For that, what we have to do is, we have to see what are those nutritional related conditions which can be identified through this anthropometry. That means, if there are nutritional related problem, how anthropometry could help to assess these nutrition related conditions in this particular age group of 5 to 19. Now, what are those? The first is stunting condition, which one come across or what one have to study is stunting. Now, what is this stunting means? Stunting is that condition where you find that you are under chronic malnutrition. It is a reflex of under chronic malnutrition or chronic undernutrition rather. When it occurs, when you say that a child has stunted or an adolescent has stunted his or her growth, when you say that, you see a child is stunting or child is under the category of stunting when you find that he or she has not grown in his or her height as compared to the age of the. This is very important. Stunting, reflecting chronic malnutrition. It occurs when a child or adolescent does not grow to his or her potential. Why it can happen? It may be an effect of, or it may be a long term effect, and that is what I said, chronic undernutrition. So, it may be a long term effect, and that too long term culminative effect of inadequate dietary intake. That is one thing. Inadequate dietary intake, that is one thing. Second thing, frequent episodes of illness coming in his or her life period, or frequent episodes of infections, or both inadequate dietary intake as well as the frequent episodes of infection. So, all these will cause the stage what is called as the stunting. Now, How the stunting is identified? The stunting is identified by using the sex specified height for the age index. See, stunting is identified by using sex specified height for the age index. Now, what stunting reflects? The stunting reflects one point, as I have already told, that it indicates the chronic undernutrition. Then it is a long term cumulative effect of inadequate dietary intake, and third thing, that child or adolescence is shorter than would be expected for a healthy child of that respective age and the sex. Now, if stunting occurs, what could be the ill effect? What can happen if stunting occurs? Okay, there is a chance that there can be a child with a undernutrition, there can be a child with a poor nutrition, there can be a child with a repeated episodes of infection in her life or in his life, and that has reflected in her or his life in the form of a stunting. Now, what could happen if the stunting occurs? What are the after effects of stunting? The after effects of stunting, one, it impairs the individual's health, that is very important, that it impairs the individual's health. Then the child will develop with a poor cognitive capacity, he won't be able to understand as the similar other child of his or her age group could. So, understanding capacity will be reduced. Then his motor development, that means the physical activity will be lowered. So, he will not be able to cope up with the physical activity or his colleagues are able to do it, right. So, naturally that will affect on his or her school performance. The second thing which you can see under the anthropometry of for this age group, first the effect we have seen, the what we can say is stunting. So, where the anthropometry can play an important role, one is stunting, second is acute malnutrition. Now, what is this acute malnutrition and how it can occur? Now, acute malnutrition is as a result of inadequate amount of quality of food, severe infection or repeated infection. See, both the things are coming here, not just the food, but the susceptibility of that particular child to receive or to have the infections in the severe form or in the repeated. That is very important, or combination of both these things, the fact under the nutrition as well as the fact under the health. Both these things can cause to result the acute malnutrition, right. So, what could be the thing which you will have to keep this in mind, that to say, when you say that a child or adolescent has got acute malnutrition, you have to see that whether that child has achieved the enough weight to his age, to his height. That is very important. So, if a child or adolescent loses the weight rapidly or does not gain the weight enough relative to his or her age, height, without or with the bilateral pitting edema, then it is called as acute malnutrition, or it can be categorized as acute malnutrition. So, in short, acute malnutrition is a result of inadequate amount of quality of food. Second, following severe or virulent infection. Third, repeated episodes of infection. Then the child is, what can happen? The thing is, the child is going to lose the weight rapidly, or child will be unable to gain the weight as the other healthy child is gaining as compared to his height and the age. And one more thing, that he or that child can develop severe acute malnutrition or moderate acute malnutrition with or without the pitting edema. To categorize all these things, is acute malnutrition as per the degree of the effect seen on a child or adolescence. This acute malnutrition can be of three categories, or you can categorize under three headings. One is thinness, second is MAM, that is moderate acute malnutrition, and third is SAM, that is severe acute malnutrition. Now, what is thinness? You can see the picture of a child who is called, or who is under category of thinness. what that picture shows? That picture shows that the child is being weighed, and you see that thinness is the category which is described for a child or adolescence when she or he is not gaining the weight as per his height. So, not gaining the weight as per his height or too low weight as per his or her height. That is the category when I say that a child is having or child is suffering from thinness. So, it is defined by using sex specific BMI for age index. It is very important point one should keep in mind that thinness is defined by using sex specified BMI index for the age. Depending upon the severity, the thinness can be, or depending upon the physical characteristics, you can see that the thinness can be of two categories. One is severe thinness and second is moderate thinness, and both these severe thinness as well as the moderate thinness, they are categorized by calculating the BMI for the age index. This is very important because BMI for the age index will directly say you the whether the child has undergone wasting or not undergone any wasting. Coming to the second category, first category we have seen, that is about thinness. The second category is moderate acute malnutrition. The moderate acute malnutrition is the term which you describe for the thinness according to the BMI for age. Now, we have seen that thinness is described on the basis of weight for the height, that index is weight for the height. Now, here the index is BMI for the age. This is very important, this index is very important. Which index you are going to use for categorizing which type of illness or which type of condition, this is very important point one should remember and one should follow. So, moderate acute malnutrition, that means MAM, is that kind of condition where the child is thin, but this thinness is categorized according to the BMI for the age. BMI for the age, it can be also called the moderate wasting. This moderate acute malnutrition can be also called moderate wasting, and along with the BMI for the age, one is also considering one more thing that is called as MUAC. That means the you can see that mid upper arm circumference, mid, that you can see in the picture, mid upper arm circumference, you know what is arm is. Now, in the mid part of the arm, you calculate the circumference and you see the length what you get, or you can say that figure what you get for that particular circumference. Mid arm circumference value is very important along with the BMI for the age. By using both these index, you can categorize that whether the child or adolescent is suffering from MAM or not. Coming to the third category under acute malnutrition, that is severe acute malnutrition. Now, severe acute malnutrition, that is a term where the BMI for the age is important. See the index. First index under the category of thinness, we see that height and the weight we have seen. In the second category, BMI for the age as well as MUSC we have seen. Now, here what is important for severe acute malnutrition? BMI for the age, that means also called as severe wasting, that is very important. Second category is, or second thing which you will have to use or which you will have to consider is MUSC. And third thing, in addition to both of these things, low BMI, low MUSC along with the nutritional bilateral pedal edema. If all these three things are there, then you will categorize that child under the category of severe acute malnutrition. So, we have seen that first we have seen the stunting, then we have seen acute malnutrition. Then coming to the third point, where we can use this technique of anthropometry in this particular age group of 5 to 19 is to categorize whether the child is underweight or not. Now, what is this underweight? Underweight occurs, especially this particular factor comes more commonly in picture of the age group of 5 to 10 years, where the age weighs less. That means, as per the age, the weight of the child is less as compared to of a, or you can compare this particular weight of a child of that particular age group to the similar age group child who is healthy, well nourished. Same age group you consider, compare two children, and you can compare these two children and you can see the weight of that particular child who you find that the child is underweight, and second you compare it with the, how you can say that the child is underweight, only when you can compare that child with a similar age group of child and see the difference between the weight. Now, if the child is underweight, what can happen, means what are the indicators to call a child as a underweight, or what are the things which are reflecting to make a child underweight rather. So, underweight may indicate, one, that child may be stunted, that means he or she has not grown to the height what she or he should be. Then the underweight child may find to be wasted, or underweight child you may find having both wasting as well as stunting. Now, if the underweight is there, or if you find a child to be underweight, why these, you have to think why the underweight has been resulted. What are the factors that can cause the underweight child? The first thing, the child has lost the weight. So, weight loss is very important. Second factor, the child has failed to gain the weight. The third factor, that child has failed to gain the height. So, all these things, all three things, see, the weight is lost in first factor, means whether the child has lost the weight. So, this is one factor, this is one causative factor to make a child underweight, losing the weight. Second, failure to gain the weight, this is on the counter side, and the third thing, failure to gain the expected height. Then during this age group, if the child is suffering from repeated episodes of illness, which may reflect on eating inadequate quantity or quality of food, all these things can cause or can reflect only on one factor, that it will or it shall affect on the weight of the child, and it can cause only one thing, or it can reflect on only one thing or one condition, that is a underweight child. So, underweight child can be assessed in the children up to the 10 years of age group using the sex specified weight for age index. See, in stunting we have seen that sex specified height for age index. Now, here we are going to use the index a different, that weight for the age index is very important. Now, lastly, a child can be called underweight where the body mass index is less than 18 to 18.5. Okay. So, coming to the other side, now we have seen till now the stunting, the malnutrited child as well as the underweight child or underweight adolescents. On the other side, a obese child or a overweight child. Now, overweight and obesity, these are the exactly opposite terminology what we have used for underweight or a stunted. So, overweight and obesity occurs when you say that a child is obese or a child is overweight. We see that a child is overweight or an adolescent is overweight when he or she has gained too much body fat and weighs more than expected for a healthy person of that same age group, similar height and of same sex. All these things will come together. You have to consider or you have to compare these things. For if you want to label a child or adolescent as overweight and obesity, then you have to compare that child or that adolescence with the other healthy persons of the similar age group, having more or less similar height and having of the same sex. So, you cannot compare a male child with a female child or a male adolescent with a female adolescent to label under any category, neither stunting nor underweight nor overweight or obesity. Now, coming to the overweight, why overweight and obesity results? What are the factors responsible for overweight? The one, nowadays the children, especially the age group of 5 to 19 years, it is being very common problem. This overweight is very common problems. Now, why this overweight has become common problem? One, that may be because of genetic element, second may be a endocrinal factor, the third very important poor physical activity, then one more is unbalanced diet and bad living habits. Now, what you can say about the poor physical activity and bad living habits? Now, poor physical activity, that means see not playing the ground games, just sitting in a one chair playing the video games, looking at the mobile or just looking at the cartoons and all, and while looking at or while going through these activity of playing a game on a mobile, or you can say the looking at a cartoon, or a cartoon is being played in front of her on a TV screen, and the child is eating at the same time. So, that makes very bad habit, bad living habit. This is one of the bad living habit. Then second thing, sleeping period is also very important. There should be a stipulated sleeping period for a child, when the child should undergo or adolescent should go for sleep, or how many hours, which are very important to be followed, because all these things will reflect on your living habits, and your living habits may be worsened, and if your living habits are bad, then you may reflect on your personality or on your weight, and a child, especially child age group of 5 to 19 years, you may find your child becoming overweight and obese. This is very important. Now, why you have to think much about this overweight and obesity, especially in this age group of children and adolescents? Why? There must be some reasons. Now, what are those reasons why you have to think about this overweight? The reasons, the first reason is, you can see that if you just do the analysis, and if you go through the those people or those adolescents or those children who has under the category of obese and overweight, you will find that these people may have got more chances of developing type 2 diabetes. That is one thing. These people may develop or may have the chances of more asthma. Then further life of these people, you may find that these people may suffer from high blood pressure. Then these people may increase the risk of getting heart disease. These people may have the risk of getting stroke. And what is more important is it has been seen that the overweight and obese children and adolescents may experience the psychological consequences, including the depression. This is very important. Summarizing this particular topic, now we have finished the topic. So, summarizing all this, the first point which you have to think is about why you need nutrition, as we have already seen, to promote the fitness and to improve your learning, to provide your body weight a good amount of energy, and how to achieve it. That is what we have seen, that to provide much nutritious food, to have plenty of plain water, and to avoid the soft drinks and the sugar as well. Then what we have already seen what would be the bad effects of undernutrition, and under those all bad effects, what is very important for this age group is lowering school performance and the achievement, and then getting the chances more of infections, right. So, all these have effect on your body, and you may develop a poor growth, you may develop a poor cognition, you may develop a poor muscle development, and what is very important is you may have a poor social life and difficulty in the school to gain whatever the achievement you want to. So, on the contrary, we have seen that what overweight and obesity can cause, and why the obesity and overweight is very important in your life. That means it can have bad effects on your life. The first thing, that it can cause early puberty in the child and a delayed puberty in the boy, and that in an adolescent girl you have seen that it may develop a gestational diabetes. So, all these things covered under the nutrition. Then we shifted to the anthropometry, how anthropometry helps to assess a child of 5 to 19 years of age or an adolescent of 5 to 19 years of age. So, we have seen that it can help to provide you an index whether for the stunting. Then you can see that how the stunting affects on your life. Then we have seen that it can have So, summarizing the things, we have seen that how anthropometry helps to you to see whether the child is stunted or not, to see that whether the child is undernutrited or acute malnutrition. Then we have seen what are the categories of acute malnutrition. We have seen the thinness, the moderate acute and the severe acute. Then we see that what are the things which we look for. Then the underweight, and the last but not the least, the overweight child. How to assess the overweight child, which child or which adolescence you called it as overweight. Then lastly, we have seen what are the effects or bad effects of the overweight and the obese child, where we have finished. So, we have concluded that it can cause the ill effects of overweight and obesity can result into type 2 diabetes, asthma, high blood pressure, increased risk of heart disease, stroke, and may experiences the psychological disturbances like depression. So, that is all for the part 1 module 4, where we are dealing with the anthropometry under the age group of 5 to 19. Thank you.